Alrighty, well, welcome everyone. Thank you so much for coming. My name is Heather Paramore. Thank you for coming to Snapshot, What You Need to Know. As I said, my name is Heather Paramore. I'm the Community Engagement Coordinator at Lutheran Metropolitan Ministry, and I'm going to be your moderator for tonight's program. I'd like to just, as we start out, give a special thanks to our partners and our guest speakers from Cuyahoga County, the Greater Cleveland Food Bank, the Northeast Ohio Coalition for the Homeless, otherwise known as NEOCH, and Northern Ohioans for Budget Legislation Equality, Noble, for their help with organizing the program tonight. Just a couple of housekeeping top tips to help before we get launched into the program. First, I want to let you know that tonight's program, we're going to feature two really great back-to-back presentations from our guest speakers, as well as we are going to open the forum for Q&A at the end. Unfortunately, because of the webinar setup, we're not going to be able to take verbal questions. However, we really do encourage you to use the Q&A feature at the bottom of your screen to submit questions. We ask that you don't submit them by chat, so we may miss those. We will do the best as we can to answer as many questions as possible. We know folks here have a lot of questions, and we're hoping tonight will help provide some clarity. We will be recording this webinar and we'll post the video to YouTube. That link will be shared out to the public once the video is posted online. Now, for what we're all here for today, I would like to set a little bit of intentions for why we're here today. So as many as you've probably heard, like I have from the news, back in 2025, Congress passed HR 1, also sometimes called the One Big Beautiful Bill Act. You'll hear throughout the presentation, we'll be referring to this as HR 1. HR 1 was a massive bill, but it made most significantly major cuts to the Supplemental Nutrition Assistance Program, also known as SNAP, or sometimes called food stamps, as well as Medicaid. These changes we know will have a deep impact on our neighbors who are experiencing hunger and food insecurity. Now, here in Cuyahoga County, we're not strangers to tough times, right? When I found since I've moved to this community that when the day seems like it's at its darkest, this community really reaches for the light. We come together in times of struggle, and I know that we as a community are going to continue to do so. In that vein, last fall, our partners here at Cuyahoga County formed the Hunger Response Team, which is bringing together community partners and stakeholders to fill needs in our community created by hunger gaps, created by these SNAP changes. Well, we know, just like any of us, and anytime we're trying to do some sort of initiative, the Hunger Response Team can't do it all. The needs are bigger than any one group can take care of. But we do know that we as a community can come together and, forge the course ahead. We have to do that in order to forge these tough times and weather the storms. In order to do that, we need to build a movement to tackle hunger. By joining us today, you are joining that movement. And we know any good organizer will tell you that every good movement starts with getting informed and knowing the facts. We know that there's a lot of confusion, misinformation out there about what's happening with SNAP. Policy is complicated after all. These implementation of these changes as they've been happening have been evolving. And I'm sure folks here, our guest speakers could even attest, sometimes it feels like it's happening on a daily basis. As we get more direction from the federal government about how they want us to, our partners at the county and other community partners to implement our programs and services related to this program. So we know you all have a lot of questions. And to help answer these questions, I'm joined today by two really wonderful guest speakers. First of all is Kevin Gowan, the Director of Cuyahoga Job and Family Services. And also joining us is Jess Morgan, Chief Programs Officer for the Greater Cleveland Food Bank. During tonight's webinar, we're going to try to tackle a few different things. We're going to try to unpack what the 8 changes were made to SNAP during HR 1, who's going to be impacted by those changes and how, what steps recipients can take to keep their benefits or reapply if they lose their benefits, and where residents can go for food, assistance with reapplying for SNAP or applying for the first time, and get the latest information, and a little bit about how organizations and advocates can get connected to these efforts. So I do also want to level set that, as I mentioned, these things keep changing and evolving. So the presentation content that you'll see tonight and here tonight reflect what we know today. and they're subject to change, with future guidance from the federal government. There may be some things that we maybe don't have answers to yet, but we can definitely as a community try to get those answers out. With that, I want to turn the floor over to our first guest speaker, Kevin Gowan, the Director of Cuyahoga Job and Family Services. Take it away, Kevin.
Thank you, Heather. And thank you for leading off with the overall comment that things can change during the implementation, because this has already started. We have seen changes occur midstream. So it's good to note that that is happening, that will happen. And the information we're giving you today is what we're aware of today. Given that, though, I'm going to jump in before I get into the changes. I was asked to talk a little bit about SNAP eligibility in general and our basic processes, just so people can level set, understand what we do. I'm going to go start out there. So if we could move forward, first to the agenda. I'm sorry, not the agenda. So I'm going to talk about who is eligible. And I am speaking, although Job and Family Services administers multiple federal programs, including SNAP, but also Medicaid, OWF cash programs, our prevention retention contingency program, as well as child care assistance. But I'm talking today about SNAP. So when we look at eligibility for SNAP, we look at the composition of the household, or as we call it, the assistance group. There are income limits, gross and net, depending on household circumstances. The residency in Ohio. Their citizenship status. This is something we'll get into because that's one of the things that has changed. And there are work requirements for certain adults. And this is really the big change that's occurred with regards to the SNAP program, which we'll get into later. Go to the next slide. So just some basics around assistance groups. Benefits are always issued to an assistance group. It's the group of people who are included together on a SNAP case because they live together and purchase and prepare meals together. Okay. The Ohio Administrative Code requires certain people to be included, whether they reside in the home, even if they say they do not purchase and prepare meals together. Sometimes we need to have people on the assistance group who do not prepare and purchase meals together. Spouses, parents and their children under age 22, adults with parental responsibility for children under 18 living in the home, by way of example. Okay. Go ahead to the next one. So the basics around income. The household's gross monthly limit, the total monthly countable earned and unearned income, is at or below 130% of the federal poverty guidelines. If you're curious what those are easily searchable on the web. Just you can type FPL and you'll probably get to them. They do change every year. And you have to be at or below 130% of the federal poverty level. Most households are categorically eligible, however. Ohio is one of the many states that takes advantage of a waiver known as categorical eligibility and may be allowed up to 200% of the federal poverty guidelines in countable monthly income. Households that contain an elderly or disabled person have certain eligibility factors waived as well. What counts as income? We have essentially two categories: earned income, wages, self-employment, tips, gig work. And then unearned income, Social Security, SSI, unemployment, child support or alimony, pensions, money from family members. That's all unearned income that we also count. We do classify them separately. So that's those two categories of income when the SNAP program is concerned. When we talk about the program in general, there are multiple ways to access benefits. We have a little handout flyer there that's probably hard to read right now, but in the basics, you can apply for benefits, update your case and check status via the self-service portal. It's something that we recommend to everybody. It's available 24/7, unless the system's down, but it's generally available 24/7. And that's where you can apply. You can check on you can check on your status. You can check on your contact information, make sure we have the most up-to-date information. You can even complete some renewal paperwork online. A little ask out here while I've got an audience. The best way to file an interim report for SNAP is actually via that self-service portal. It's very automated, very easy to use, and actually ends up with faster processing on our end. We also have accessible drop boxes in our lobbies and outside the virtual e-Brown building. Forms are available in the vestibule of all our locations, and we accept fax. And we have partnerships with our local libraries who also assist people in faxing information in. That includes the Cleveland Public Libraries, the Cuyahoga County Libraries, and the Shaker Heights Libraries. All have some dedicated equipment to allow you to help file an application, send us paperwork. The great partners in these efforts. In order to apply for SNAP, we need a complete application. And that's called the JFS 7200. It's actually the JFS 7200 for any program, but you must use it for SNAP, and you've got to include your name, address, and signature. Okay. Pages 6 through 17 must be provided to us when you send that application in. You can do the electronic equivalent. You can apply through that self-service portal, which is available through ohiobenefits.gov. You can submit a full application through there. We don't need the paper application. Again, for those who it's available to, electronic applications tend to be quicker on us or quicker for us to process. You can also do the telephonic equivalent. You can call and apply on over the phone. We can capture an audio signature via our contact center. So the processing steps for us, when we have a SNAP application, normally what we do is schedule an intake interview, mail the appointment notice out to the customer. The customer then calls in the agency to complete the scheduled intake interview. I'm going to stress right here, if you call in on the day of your interview, you're going to experience a shorter wait. It's much easier to get through. If you're calling late, those calls are on-time calls are prioritized over the late calls. We do determine during a call if additional information is necessary. It usually is. If we need documentation, you'll be offered the option to complete a document upload via your smartphone. That's technology that became available last year, where we can push a notification to your phone while you're on the call with us, and you can upload via your smartphone. But if you're unable to do that on the line or through that phone push, you'll receive a checklist from us. It's a JFS 7105 requesting for information is mailed to you, and we're giving you 10 days to provide that necessary verification. Once the interview is complete and all necessary verifications are received, the agency will make an eligibility determination. If mandatory verifications are not provided, this is per federal code, we have to deny that application. We also have a mandate in front of us to determine that eligibility within 30 days. Or 7 days if it's expedited. There are situations in a household that require us to expedite that. And so then for those cases, we only have 7 days to determine eligibility. Okay. So that's the basics around SNAP applications and SNAP eligibility. I'm going to talk now about the changes that have happened as a result of House Resolution 1 in order of the timing, so to speak. For the first thing to happen as a result of House Resolution 1 was a restriction on SNAP eligibility for non-citizens. Next, that was November 1st. Next, March 1st of 2026, work requirements were implemented for SNAP recipients. I want to make a quick note, although I didn't think I noted later. There were already work requirements for SNAP recipients prior to House Resolution 1, but House Resolution 1 greatly expanded that. I'll talk about that in a bit. And all SNAP recipients who are work required do get 3 what we call countable months of SNAP before penalty kicks in and they're removed. So in other words, if you are work required and you applied or you started receiving SNAP in March of 2026, March, April, and May, you were allowed to continue. receiving SNAP without meeting the requirement, but on June 1st, you would have lost your benefits if you hadn't complied. Okay. So June 1st was the first projected disenrollment of SNAP recipients. It did occur. I don't know the impact of that yet, but we do know that the first recipients to be truly impacted by those work requirements, that occurred on June 1st. And then the next change is on October 1st of this year. That's a reduction in federal administrative funding. Okay, and then the next change is a year after that. At that point, Ohio, depending on their error rate, will have to potentially share in SNAP benefits, meaning that Ohio will be responsible for some of the money that's actually sent as benefits, where previously it was 100% federal money. So let me talk first about SNAP non-citizen eligibility. As of November 1st, to be eligible for SNAP, you must be a U.S. citizen, a U.S. national, a granted Cuban or Haitian entrant, a member of the Compact of Free Compacts, of Free Association, or a lawful permanent resident. But if it's think green card, you must possess a green card. And for those lawful permanent residents, you do also have a 5-year waiting period. So green card holders who have only been here a year are not qualified, or you're not eligible for SNAP, pardon me. There are, however, multiple exceptions to the 5-year waiting period. I cannot go into them all right now. They're a little in the weeds, but most importantly, minor children who are lawful permanent residents are immediately eligible for SNAP. These changes were rolled out in November, but the full impact of them, because quite frankly, some programming difficulties and some fairly complex deliberations over what the legislation was actually letting people or was allowing. The full impact of these changes weren't really felt till February. However, in the end, just under 2,000 non-citizens in Cuyahoga County became ineligible because of these new HR 1 rules. And I want to note, although I'm not here to talk about Medicaid today, these essential same changes, there's very little difference between the two, are going into effect for Medicaid on October 1st of this year. Now to jump into the work requirements, House Resolution 1 implemented changes to who is required to complete a work activity to be eligible for SNAP. Previously, it was anyone from the ages of 19 to 54 who did not have minor children in our household was likely to have a work requirement in front of them. They had to meet certain hours, certain activities in order to continue to receive SNAP. As I mentioned earlier, House Resolution 1 greatly expanded that. They moved the age range up from 54 to 64, so that added 10 years worth of work requirements, so to speak. They also added work requirements, or it also added work requirements for parents whose children are all age 14 or older. In other words, if your children or you have a child in the household who is 13 or younger, you're not going to have a work requirement. But if all your kids are 14 and up, you are going to have a work requirement. And finally, there were existing exemptions for the work requirements for people who are veterans, homeless individuals, and former foster care youth. Okay, those were removed with House Resolution 1. Okay. Good. So, having said that's the basics of who now has work requirements in front of them, there are multiple exemptions, and I will say that exemptions are generally where we are preserving people's SNAP benefits under these new resolutions. By way of example, we had in that expanded population, including the 55 to 64-year-olds, including the people whose children were all 14 and up, and including those exemption categories I mentioned, who all now had work requirements in front of them. Just by looking at a automated run of the database, some analysis, we were able to exempt over 15,000 people from work requirements based on what I'm about to go through. That did leave, however, 5,000 people who ended up being part of the work required population. Those exemptions are, though, physically or mentally unfit for employment, caring for an incapacitated person, caring for a child under 6, applying for or receiving unemployment, participation in a drug or alcohol treatment program, enrollment in school or training half-time or more, working 30 hours a week, 30 hours a week or the equivalent pay. If you're a Native American, and those that specific phrase in Indian, urban Indian, or California Indian is right off the federal legislation. If you're residing with another assistance group member who is under the age of 14. And finally, if you're pregnant. These exemptions, and one of the changes that we've had to adapt to just this month, these exemptions that you see before you now, not all of them applied to the 64-year-olds in Ohio in the first 3 months of the rollout of these work requirements. There was kind of a legislative debate amongst the states and the Fed. The federal government clarified very recently, as in June 1st, that all exemptions are available to 60 to 64-year-olds. Some of you may have seen some flyers we put out indicating that 60, 64-year-olds are not eligible for certain exemptions. We are pulling that back because they have changed their policy for the better, so that there are more exemptions available to 60, 64-year-olds. Frequently, when we're looking at these exemptions, the most common exemption is physically or mentally unfit for employment, pardon me. And in order to document that, for all of these things, we need some level of documentation. So in order to document physically or mentally unfit for employment, we simply require documentation from a medical personnel stating that the individual is unfit for work. It does not have to be a doctor. It just has to be a medical staff or medical personnel stating the individual is unfit for work. Okay. All right, I can go to the next one now. Okay. And I kind of skip over parts. I think I probably should have included on the slide here. So briefly, the work requirements involve working 80 hours per month or volunteering 80 hours per month. Okay. In a very brief nutshell. If you are working if you're satisfying those hours for volunteer work, which we find that most people, especially in the older age group, 55 to 64, if they're meeting requirements, they're often doing it through volunteer work. And we need to document that. So we have a form for it. It's the JFS 7410. And we need it to be completed in order to verify that and continue and preserve your SNAP benefits. And essentially, the SNAP recipient completes section 1 of this form. And then whoever the person or entity they're volunteering for or providing services for needs to fill out sections 2 and 3. And both the customer and the person receiving the services sign the form, and they submit that completed form to us, to the local JFS office. You can do it mail or in person or fax. We do have that form currently available in our website's form library. We'll provide you with links on that after the program. Okay. And that is all I have. I know there are questions, but we want to keep the momentum going. I'm going to hand it over to Jessica to talk about the food bank and their efforts to combat food insecurity.
Great. Thank you so much, Kevin. And good evening, everybody. My name is Jessica Morgan. I have the privilege of serving as the Chief Programs Officer at the Greater Cleveland Food Bank, where I get to work with my team and lead hunger relief programming across our service area. We have partnered for a very long time with the team at the county around providing access to resources, namely SNAP and other public benefits. And they have been doing an amazing job helping to educate the community and serve neighbors who have questions about the changes in SNAP. And so I just would like to thank Director Gowan and his whole team for their diligence and the work that they have put in to this project. My part of the presentation is really to talk about the resources that are available to people beyond SNAP. So as folks navigate the challenges around SNAP, we do want them to know that there are resources available out there, the food bank being one of those resources. And so I'm going to spend a little bit of time talking about that. First, I do want to highlight our mission statement, which is together with our community, the Greater Cleveland Food Bank provides nutritious food and essential resources so our neighbors facing hunger can thrive. We do this through food distribution to a network of partners who I will talk about in just a moment, as well as the work being done at our Community Resource Center. Next slide. So for those who are not familiar with the Greater Cleveland Food Bank and where we serve and who we partner with, we have a service area of 6 counties in Northeast Ohio, and you can see each of those counties up here on the screen. We don't just serve Cleveland and we don't just serve Cuyahoga County, but we go all the way to the Pennsylvania border in Ashtabula County, and we go halfway down to Columbus as far as Richland County. And there are 12 food banks across the state of Ohio and 200 food banks across the country. Next slide. Last year, our food bank, in partnership with our 1,000 programmatic partners, served 1 in 5 people in our service area. That is more than 400,000 unique individuals. Next slide. And we do that through partnering with hunger relief organizations all over that service area I just showed. We have a number of partners who are providing multiple hunger relief programs across our service area, and you can see those programs up here listed on the screen. I'm going to talk briefly about each one. Food pantries are probably the most common amongst our program types and probably the most familiar to the community. Food pantries are typically located at faith-based organizations, community centers, and other nonprofit social service providers where those organizations get food from the food bank, they store it at their location, and they distribute either bags of food to people or offer a choice shopping experience inside of their location. The vast majority of our partners that we work with offer a food pantry, and it is also one of our most impactful programs in ways to get healthy food out to people. We also work with organizations that provide open community meals to anybody who's in need of one, or shelters. We do a number of community fresh produce distributions. These are pretty common in our community. You may have seen one of our food bank trucks pull up to a nonprofit organization or a community center and unload pallets of fresh produce. And we work with a number of organizations to help get healthy fresh produce out, targeting anybody who's income eligible, older adults, and children specifically. We also have a number of programs specifically for kids. So we offer an after-school meal program called Kids Cafe. That is where we deliver fresh meals to library sites and after-school programs where kids can consume the meal on site before they go home for the night. We have a backpack program. That's where we provide meals for one child over the weekend. We work through schools and other social service organizations to get that food out. It is the heart of summer right now. We are partnering with about 100 different sites across our service area to provide free breakfast and lunch to kids over the summer months when they are not in school and do not have access to the National School Free Breakfast and Lunch Program. And then we also offer a school market program where we bring fresh produce and other kid-friendly items out to a school at the end of a school day for the students and their families. In addition, we offer targeted programming for older adults age 60 and up. Our first is our Senior Box program. This is a commodity program that offers shelf-stable foods to designated seniors each month. We also partner with organizations like the Western Reserve Area Agency on Aging to provide congregate and home delivered meals to senior centers across Cuyahoga, Lake, and Medina County. At the food bank, we have a production kitchen where we can make the meals in-house, and then we work through partners to get those out. And then we also offer fresh produce distributions called senior markets at senior-friendly locations. And we also have a pretty big emphasis on nutrition and food as medicine. We know that healthy foods are very important for individuals who have chronic illness. And so we work very closely with our healthcare partners to offer fresh produce, food clinics, and also nutrition education. Next slide. For folks who are in need of emergency food assistance, we do offer on our website, and I've got the screenshots up here, a food finder opportunity. So folks can go to our website, they could type their address in, put a mile radius in there of how far they're willing to travel, and it will pull up all of the open, or open to the public, I should say, open to those who are income eligible, food pantries and community meal sites, including fresh produce distribution distributions in their neighborhood. Sometimes there's a distribution happening and people don't even know about it, or maybe there's one happening near somebody's place of employment. So this is a really great resource. And for those on the call today who want to check this out, I highly encourage you visiting our website and looking at this Food Finder app. Next slide. So there's a difference. Kevin talked about the eligibility for which is then the income eligibility for emergency food assistance. So if a neighbor were to go to a food pantry, who is eligible to go? The food bank and our partner agencies serve households who are at or below 200% of the federal poverty line. Ironically, today, new income guidelines were just released. I haven't had time to update my slide here with those new income guidelines. They just came out about an hour ago. So these are the fiscal year 25 income guidelines. The fiscal year 26 will be a little bit different. But the Ohio Department of Jobs and Family Services updates the income guidelines on July 1st of each year. If a household visits a food pantry, they will be asked to self-declare their income. Our food pantry partners, as well as the food bank at our community resource center, we do not check income. We are not permitted to do that per the USDA. And so folks just need to give their basic household information and self-declare that they are income eligible to receive emergency food assistance. Next slide. So we know that we oftentimes say that hunger is the symptom of another problem, right? People are struggling with accessing healthy foods, being able to afford all of the food that they need, because they are also dealing with challenges in other areas, like being aware of different services and benefits that they might be eligible for. There might be issues with transportation. There might be challenges when it comes to work. Perhaps folks are working, but just not making enough to make ends meet and to pay all of the bills. We also know that food is just more expensive right now. So when we are going to the grocery stores ourselves, we know that food is just more expensive, and so the dollar is not stretching as often and as frequently as needed. There are challenges with housing, mortgage payments, rent payments going up, utilities going up. And so all of these different things contribute to reasons why people are faced with making really tough choices. Next slide. So at the food bank, not only are we working through our network of over 1,000 partners in many of those different hunger relief programs I just went over, but we're also really focused on helping people through direct service. And so about 3 years ago, we opened our very first community resource center, which is on South Waterloo Road in the Collinwood neighborhood in Cleveland, where we're really working through 3 key pillars. The first is, of course, addressing hunger through a help on site at our Waterloo facility, which is open on some evenings and every other weekend, to really help people who are in need of food support today. We are also partnering very closely with a number of organizations, including the team at the county, to make sure that people are aware of and eligible for and applying, if they're eligible for public benefits like SNAP and Medicaid. And then we're also really working with our on-site partners. We've got a number of partners who co-locate with us, and I'll share who they are in just a moment, to help address the underlying issues of hunger, things like healthcare, housing, employment, financial literacy. So if somebody is coming to the food bank's community resource center and is in need of food, we can also connect them to other resources on site that day, so they do not have to go from place to place to place. Next slide. And the vision for our resource center is really to offer a center that not only provides increased access to healthy foods, but connects those individuals that we are serving to other key services in a really collaborative effort to improve the household's food security. So we are doing that jointly with our community resource center partners, and we are having a real impact there. Next slide. Here are the organizations we are currently working with at our resource center. You can see all of their logos up here on the screen. And we are really proud to partner with all of these organizations to help make access to service easier for our neighbors. And last year, we were able to serve a little over 50,000 unique individuals at our community resource center. Next slide. We've gotten a lot of questions about, how can somebody access the resource center? What do they need to do? Our community resource center is open Monday through Friday, as well as every other Saturday. And our market is open multiple hours throughout the week. Neighbors can come and shop twice per month. And we are providing our neighbors with access to a lot of healthy food. Each household is able to take home up to 80 to 90 pounds of food. That saves our neighbors per household roughly $250 a month. So we oftentimes like to tell folks as they manage their budgets for the month, they can access the grocery store and use their SNAP benefits first, and then come to the food bank, one of our partner agencies or our resource center, to try and grab some other items, or vice versa. Come to the food bank first, see what they can get, or to one of our partner agencies, and then go to the grocery store to use their SNAP benefits. Next slide. We have a team on site at our community resource center called our community access team, and they are really working closely with our neighbors to identify other services that they might be eligible for. Making those connections to our on-site partners is really crucial, and we want to make sure that every neighbor who comes in to our community resource center knows that our team is there to help them and help them make connections. We also know that when you come into our resource center for the first time, it might be a little bit overwhelming. There's quite a bit happening. It's a very busy place. So we do encourage people to come back and learn more about what our resource center has to offer and learn more about all of the great and wonderful resources available to them on site. And our access team is there to help them. So I mentioned some of these stats already, but just to highlight them once more, last year we served over 53,000 unique individuals. About 50% of those that we served were kids or older adults, and about 16% were new. That means that 16% of the people that we served had never been served by the food bank or one of our partner agencies before. This is a really important number for us to have a pulse on. We do track this number overall. And the more new people we see, the more that concerns us. We want to make sure that folks who are facing tough situations, that they have the opportunity to get help. But it's really important that we understand why they're there. And so our team is also working on collecting stories and learning from our neighbors about what brings them in. About 62,000 total visits were made, and we distributed a little over 4.5 million pounds of food. Next slide. I'm excited to share that we will be opening up a second community resource center. This is in the Cadell neighborhood on the near west side of Cleveland, right on the corner of 98th and Lorraine. In fact, last week we just had our unveiling of the center and the kickoff to our construction. We will be opening this site in early 2027, so please stay tuned for more information. But this will just be another really wonderful way for the food bank to provide access to resources, for us to work with amazing community partners like the team at Cuyahoga County. So more information to come, and I think I've got a couple more slides that tease what the inside of the center will look like. So next slide. This will be our lobby area. Next slide. And then, of course, we'll have a healthy choice market offering lots of fresh fruits and vegetables, lean proteins, dairy, whole grain items, very similar market at our center. And then just to wrap things up, we do have a really wonderful team of staff who are out in the community regularly. This is a team who goes to community events, who meets our neighbors where they are to help them get connected to public benefits. So we can complete applications for our partners at county JFS offices and submit those on our neighbors' behalf. And our outreach work is one way that we do that. So we have a staff staff who are out in the community every day. We have bilingual staff who are able to reach people in both English and Spanish. And this has been a really wonderful way for us to not only connect people to resources, but also help to educate our community about the most recent SNAP changes. Next slide. In addition to our outreach work, we also have some root cause coordination. Now, my background is in social work, and so I really like the fact that the food bank offers this service. We have staff who help connect people to some deeper resources in these key areas. So we've got a staff member who works very closely with our older adult population, especially older adults who might find themselves in crisis. We have a wonderful relationship with all of our healthcare institutions. And we are taking referrals from healthcare institutions via our help center, which I'll talk about in just a minute. And those referrals allow us to follow up with individuals who have chronic disease and illness and who are in need of emergency food and assistance. So that has been a really wonderful service we offer. We do a lot of work around workforce development. While we don't have any specific workforce development programs at the food bank, we work really hard to get people who are looking for advanced work or new work or higher paying jobs into programs that do offer those opportunities. And then lastly, we are elevating issues related to public benefit access often and frequently so that we can help make sure that people are connected, those that are eligible, to things like SNAP and other public benefits. We also do quite a bit around advocacy. We have a neighbor advocacy committee, which is a group of individuals who have accessed public benefits and food bank services. And so that group meets throughout the year. We offer educational opportunities and ways to engage them in our work, and we learn from them. That is the most important thing. Next slide, and I believe this might be my last slide. And then lastly, we offer a help center. The phone number is up here on the screen, and we can talk to people. They can call our help center. We're open Monday through Friday from 7 a.m. to 6 p.m. And help people with a number of things, including if they need food that day, we can connect them to a program partner who is open near their home. We can help them by completing public benefit applications and then submitting those on their behalf to their local Jobs and Family Service office. And then our team is very, very well versed on all sorts of different resources beyond food assistance. And so oftentimes when we're talking with our neighbors on the phone, we learn about other things that they might be in need of or qualify for, and we can work to connect them to other resources. Our team is compassionate and empathetic, and will treat folks with respect, and it has been a really nice way for us to connect to our neighbors. And I think that is the bulk of my presentation, but I'm going to turn it over to Heather, who I think is going to lead us through closing this presentation out and some Q&A if there are some.
Thank you so much, Jess. Yes, we definitely want to open up to the Q&A. I know we've had a number of questions come through. I actually wanted to ask a question first before we jump into everyone else's. And this one's for Kevin. Kevin, I didn't know if you could talk to us about how these SNAP changes have impacted folks who are experiencing homelessness, our veterans, or our former foster youth.
So in terms of the impact, it's difficult for me to say. What I can say is that we have seen, like I mentioned earlier, 5,000 people on that work required. I will point out that because of federal regulation, this didn't all happen on June 1st where 5,000 people lost their benefits. It's going to roll out every time someone is certified for SNAP for the first time under these new regs. That's when the 3 countable months, that's when the clock starts on their 3 months of SNAP before the work requirements result in a penalty. And the overall, what we've seen in terms of the population of newly work required, roughly 1,000 homeless were suddenly work required. For veterans and for former foster care youth, it was a much smaller number. It was around 100 each. And then the roughly over 2,000 people who are age 60 to 64 were suddenly work required, 1,000 people who are ages 55 to 59, and then roughly 1,000 people who were in the usual age range before, from age 19 to 54. However, because their children are all over the age of 14 or over the age of 13, they now found themselves work required. That was kind of the breakdown of what we saw in terms of people who are now work required. The impact is obvious in terms of they have the potential to lose access to SNAP, lose access to and start to experience food insecurity. But that's what I know at this point in terms of the impact of Cuyahoga County.
Thank you. I mean, that answers my question. So we have quite a few in the Q&A. I also want to remind folks, if you could, just to be helpful for us, we know we have a lot of questions. For those of you who may have, if you posted a question in the chat, if you could copy that question into the Q&A feature box, that would be extremely helpful for us. We don't want to miss your great questions. One of our first questions, it was kind of a two-parter. It asked about, one, a timeline of when changes began, which I think you covered in the beginning of your presentation. But the question for both of you is just, in the interim, while there's this transition period, folks are starting to lose benefits or maybe, getting kicked off, what kind of assistance or access to help exists out there for folks? And I don't know, maybe Jess, this might be an opportunity for you as well.
Sure. So if people are getting kicked off of benefits because of non-reporting or some other reason, they can certainly visit our community resource center if they are income eligible. For SNAP, they are income eligible to receive food from the food bank or one of our partner agencies. I highlighted the Food Finder app on our website. That is a great place to start to find a local food pantry in your community. Also, our help center, whose phone number is, I'll repeat it. It was on my slide, but I'll repeat it. It's 216-738-2067. That is a great place to start as well. You could talk to somebody about what you might be struggling with, and we can make referrals on that household's behalf, including connecting them to food resources and allowing them the opportunity to apply for SNAP and other public benefits, which we then partner with the county on, of course.
Thank you so much. One question that was asked was, does the person verifying the unpaid work need to be from a 501c3 organization?
I believe that's for me.
Yes.
No, no, they do not. It can be in-kind work. You could be helping a neighbor who needs help. It is fairly informal. There's a form to fill out. Obviously, I showed that earlier, but it does not have to be a 501c.
Okay, great. Someone asked, specifically to you, Director Gowan, can you speak to the process a person should follow if they lose their food benefits for not following work requirements? Do they receive some type of warning before losing their benefits? How soon can they reapply? So if you could talk through, I think, everything from what happened, the stages of what can happen, and how they respond.
So in terms of the overall change, everybody who was identified as either potentially or very definitely work required was sent a notice saying that due to changes in federal regulations, but you will be work required starting in March. Two notices were sent out in January regarding that to let people know that this is coming. And then for individuals who are going to lose their benefits, first off, they had to have gone through certification. And during the certification process, we have actually, for people going through recertification in particular, we have a separate group of caseworkers working with them. And they are informed at that point that you will have 3 months of benefits before you have to meet the work requirement. So if it was March 1st, they will have known that May would be their last month of benefits. A formal notice goes out in this time for the May recipients. The people who the first wave of people, they received notices on April 30th. They were mailed out on April 30th, letting them know that you've already had 2 months pass without meeting the work requirement. And this is to formally notify you, unless you start to meet the work requirement, you will lose your benefits as of May 31st. We also, at the county level, use text messaging and emails to reach out to people to let them know that this was going to happen. And I would point out, though, that generally with this population, we see frequent changes in phone numbers. So we know that we're not reaching everybody, but we did make that attempt. So they do receive a formal notification. We're doing text notifications, especially during this first year, to let people know that it's happening. So they do receive notice, yes.
Okay, great. Thank you so much. So there's been a couple questions about if folks or representing organizations or other groups that were interested in taking volunteers, how do they get connected to the county or whomever else would be appropriate to make sure that the word gets out to folks? Is there a process involved? Is there someone specific that they should contact?
Yeah, so before I get there, Heather, I think there was a second part to that question I didn't answer
You know
regarding
what?
how.
Great memory. You're correct. There were some folks who wanted to know about, okay, once we lose our benefits, how kind of the steps to be able to get free.
Yeah, so they obviously have to reapply to, maybe not obviously, they do have to reapply to receive benefits. And unlike previously, when they applied or when they were certified, they will have to demonstrate that they're already complying with the work requirements before we can approve them. So it's a different process for someone who's lost their benefits. They go through the same process in terms of income eligibility and household composition and all of those requirements for regular SNAP eligibility, pardon me. But they also have the added step of having to show that they are currently meeting their work requirements before we can reestablish eligibility. So I wanted to get that in there. I realized I hadn't answered that. The next question regarding volunteering, we have partnered with the Greater Cleveland Volunteer Network, and we are sending people through that way. I will also note that we don't recognize partners. We don't have to, if someone volunteers and we get paperwork signed by the SNAP recipient as well as the person or the entity that is verifying that they have been volunteering with them, that's all we need. We don't need to recognize the entity. We don't have a database of formal volunteer networks. If you want to reach out to us, you can reach out to our communications page, indicating that. And then also our work activities team. I don't have their email with me. I can get that back out to people. The work activities team being the team that is working on this work requirement piece, to let us know that we can refer people out to you.
Thank you. For okay. Are there mobile units that can process applications at the community event?
You broke up a little on me, Heather. What was
Oh,
the question?
sorry. I said, are there folks who are mobile or going out into the community or can go to events who can help people with application questions or things like that with their benefits?
So the first, yes, on a limited basis. One of the things that I mentioned but did not go into detail is one of the many things that House Resolution 1 did is reduced our funding. The full impact of that hits October 1st. However, we're already feeling it. So we do not have the staffing to send out into the community. We have to staff our lobby. We have to staff our phones. And that's our unfortunate reality. We do, however, through our Comet initiative, send people out into the community, usually to resource fairs, community fairs, and those workers who are at those can answer questions about eligibility. People frequently are asking what the status of their case is. We normally have workers there answering those questions. They have full access to their system. They bring their laptops with them. They can look the people up. They can also help people make some changes, potentially apply, and we do that. But that's based on a request for us to come out to those resource fairs. Bit limited in what we can do, but we are out there in the community. I would also recommend, as Heather mentioned, not as Heather, you're Heather, sorry. As Jessica mentioned, that the food bank, we do have staffers at the food bank Tuesday, Wednesday, Thursday to help with applications. We accept applications there. And the food bank is out in the community as well. They're well trained in the SNAP program. They help people file applications and help them understand the program as well.
I think it's a great segue too, Jessica. I didn't know if that you could talk a little bit too about what the experience would be like for someone coming through the food bank to get some of that, whether it's calling the phones or coming to community resource center. How aside from getting the food, which I think everyone kind of knows about, how can how does the food bank kind of help you know get people applied or help them navigate the system? Can you kind of give us an idea what that looks like? So
Sure.
for
So
folks.
I mentioned a couple of teams, which are our community access team and our community outreach team. At our community resource center, so our CRC, our access team is stationed. They are full-time staff who are in the door, asking folks what brings them in that day. And then we will listen. We will ask people how we can help them. If that is connecting them to our choice markets, we will do that. If it's connecting them to another provider on site, we will do that. If it's helping them fill out a SNAP application or Medicaid application, we will do that. The great thing, and Kevin just mentioned this about having the county on site 3 days a week, is that instead of saying, hey, call this number, we can walk them right down the hall to the county caseworkers that are co-located with us. And that has been an amazing resource. So again, they are there on site at our South Waterloo Community Resource Center, Tuesdays, Wednesdays, and Thursdays. And then when we open up our West Side Community Resource Center, they will also have a presence there. Our outreach team is out in the community. So they are meeting neighbors where they are. We are attending community events. We are attending, health clinics and fairs, setting up a table. We've got resources available with us. Sometimes we bring some food with us, some healthy produce or some other quick grab items. But it's a great way for folks who maybe can't make it down to our resource center. It's a great way for us to connect with them out in the community. And then lastly, our help center. I can't stress our help center enough. If folks cannot get out, they can call our help center phone number. That number is 216-738-2067. And we can help people over the phone get connected to emergency food assistance, talk about our resource center, or help them with various public benefit applications.
Thank you so much. I think we have time for one more question, and I'm sorry, everyone. I know we have a lot of questions. Someone wanted to know if you could talk about the and this is for Director Gowan. Can you talk a little bit about the difference between the unpaid and paid, like paperwork and their worksheets, like kind of illustrate to what that is, or in terms of documentation you have to turn in?
Yeah. So the worksheet that we shared in the presentation, the 7410, that's for unpaid work. That's for volunteer work. If you're being paid, your pay stub is what we need. It's that simple. It's not a separate worksheet. We will ask you for your pay stub.
Thank you so much. Well, I apologize, everybody. I unfortunately wasn't able to take any more questions, but we will do our best to pass these along to our partners at the county. And I know that they've been putting together a lot of great resources in terms of different frequently asked questions and information on the Hunger Response Team's website. But I also want to thank you all so much for coming tonight. On behalf of Maria Foch, our CEO, the rest of us here at LMM, as well as some of our partners I mentioned on the call at NEOCH, Noble, at the county, at the food bank. Thank you all so much for coming. Thank you to those partners for being part of this, and also to Jessica and Director Gowan for answering all of our questions and trying to clarify some of this. If you want to stay connected to the latest updates and information, so as we said, things are rapidly changing as everyone gets more information from the federal government. These are the official channels that you can tap into and log on. As I mentioned, we're going to be sending out these slides, so you'll be able to get this information as well from there, including some of the things for the Hunger Response Team. However, if you need food and you need assistance today, that's what our partners here at the Greater Cleveland Food Bank are for. So please don't be afraid to reach out to that help center and talk with their help coordinators. Find out more about their resources. We as a community need to be, get connected to the resources that are going to help us all eat. And if you're someone of means and you have the ability to support others and make a donation, I'm sure our partners at the food bank would be more than happy to help or help answer your questions. Thank you all so much. And as a reminder, will be posted on YouTube and sent out by our channels later this week. Thank you so much. Have a great evening, everyone, and take care.